Welcome to the PharmaSource podcast. In today's episode, I spoke to Len DeCandia, former Chief Procurement Officer at Johnson & Johnson, and prior to that, SVP for Supply Chain Management at AmerisourceBergen and Chief Supply Officer for Roche before that. It's an amazing conversation that's full of advice for how procurement leaders should become more strategic and earn a place making decisions at the very highest levels within pharma. He also gives an insider's view on what happened at J&J during the COVID pandemic. Len, really great to have you with us. You've had an incredible career right at the very top of supply chain and procurement in pharma for, I'd say, 3 decades, but possibly 4. And I'm interested in your perspective on how things have changed over that time and the kind of leadership and organizational shifts which are going to be necessary for the next decade.
Yeah, thank you. And again, a real pleasure. I appreciate the invitation and happy to be part of the dialogue here. Yeah, a significant amount of change, Luke. I think when you look at the past 3 or 4 decades, I started my career in the early 80s, and the industry was quiet. It was quiet but effective. But the amount of innovation that I've seen over the past 4 decades has been absolutely incredible. And I think the function has had to evolve with what's happening in the space around innovation. And literally, the whole cycle from terms of the amount of knowledge that resides now in the patient community, that knowledge has really translated to creating more challenges for all of us in the supply chain. So if you go back to the early days and you talk about small molecules and just pumping out a lot of pills, it was really an incredible push type of supply chain and a fairly small community with a lot of players. So it's a lot of consolidation that we've seen through the years. But I think as time has passed and we go from the 80s into the 90s and we started to see the introduction of innovation in the form of large molecules. So when I was at Roche in the mid to late 90s and, Roche had acquired a little company called Genentech, right? And so they were early into the biologic space. But the process and the execution of the product became that much more complex, right? Mm-hmm. And so what happened along with that complexity, the amount of knowledge and expertise and the amount of investment and capital investment to be able to support that has absolutely increased. And then, for me, when I look at my own career, once we started to push out more complex products, we really needed to understand what was happening downstream, right? So, the commercial organizations in the 90s were all about getting a script. So if you could get a physician to write a script, everything was great and everybody, was happy and we can push more product out. But we really started to want to better understand what was happening as it relates to outcomes. We really wanted to know how effective products were in the marketplace. And so we really needed to better understand the distribution channel. So I think supply chain has evolved from getting a plant to run more efficiently to really understanding what was happening on an end-to-end basis. So we started to see greater collaboration across the entire supply chain, along with technology like big ERP systems that started to show up in the mid to late 90s, and I had a huge implementation of an SAP system back in the late 90s and early 2000s at Roche, right? So now we started to think about what was happening outside of our plants. So how are our suppliers doing? What were they up to? And then what was happening with our product once it got into the channel? And then 9/11 really changed a lot of the thought process around not only the availability of product and where product was, but a safe and secure supply chain, right? So we wanted to ensure that our products weren't becoming weaponized, and we wanted to make sure that we understood the integrity of our products, right? So we started to want to better understand. And so when I went to AmerisourceBergen, one of my big responsibilities there for at least the US supply chain was to make it a closed supply chain. So to move the relationship from distributor to manufacturer from a asset transfer, thank you very much, and you can take it from there, to more of a collaborative experience, right?
Was that around the same time as the heparin incident? Because that had a big impact on supply chain integrity.
Sure was. Yeah, there were 2 things that were really going on. So we're talking about 2003, 4, and 5, right? We still had the hangover of 9/11. And, we started to really understand, and there was a real concern about a safe and secure supply chain. You had the issue with heparin. And so what fundamentally happened was the manufacturers ultimately had the accountability of what was happening to their products downstream in the channel. The distributors, were fundamentally saying, hey, we can handle it from here. And the manufacturers were saying, well, wait a second, time out. Yeah, ultimately, they're going to come after me. So we had to find a more integrated way for manufacturers and distributors to continue to collaborate and still achieve their business objectives. And literally, we moved from what we call the buy and hold model, right? So I walked into an environment where the distributors made their money on the fact that they could buy a lot of inventory right before a price increase, because most manufacturers had a pretty, legitimate and I would say rigid schedule around price increases, and they would make money off of that. And ultimately, what that did was it created a bit of a place where there was no transparency or understanding of what inventory was in the channel. And so the manufacturers wanted to know what was happening down there. So the relationship had to change from a buy-sell relationship to a collaboration relationship. And ultimately, what we ended up putting in place was called the fee for service, which is still in place today. And what the manufacturers were actually going to be able to do now was to pay a fee, not so much for the distribution of their product, but pay a fee for data to really understand what was happening downstream in the channel, right? And so the distributors recognized that their information was critically important. And the manufacturer's business case was on the fact that they were having billions of dollars of obsolete inventory expiring or coming back from the distributors. And so eliminating all of that inefficiency in the channel, as well as creating full transparency so that you could see from a manufacturer's perspective exactly where that product was going and where it was dispensed. Before, they were just working off of very late prescription data that really didn't help them in terms of being able to run their plants and manage their own inventory. And so it really not only took billions of dollars of inventory out of the system, but it also took billions of dollars of capital waste out of the system. So now you really understand where to invest your capital around capacity and how to better use capacity, especially with pharmaceutical products that have a much longer time to execute the particular products. So that was a significant experience and learning for me personally. I had to negotiate with 300 pharmaceutical manufacturers that distributed product in the United States. I think I broke the oligopoly of the distributors. So I wasn't friends with Cardinal Health, in McKesson, but at AmerisourceBergen, I think we put a model in place that stands the test of time today, and everyone's doing extremely well. At the time, people were concerned that it wouldn't work, but now it does. So now, for a pharmaceutical manufacturer, when I went back into the manufacturing space, there was an understanding of what was happening downstream. So I could translate what was happening downstream to how I could best utilize my capacity. During that time, we started to see much more of growth in the specialty space. So much more targeted treatments, much more complex molecules, much more sophisticated manufacturing processes. And I think if we hadn't put those transparent models in place, it would have been that much more difficult to evolve to the more complex molecules relative to putting those products in place. And I think, what we've also seen, and you've seen it more in other parts of the world, especially in Europe and in Asia, but in the United States, we've seen more of an evolution towards a lot of the traditional small molecule products moving into the generic space, and many of the exclusive manufacturers now more focused on the more complex molecules. Now, executing those molecules and developing those molecules has really moved supply chain away from how do I get my plants to run more efficiently to much more sophisticated relationships through licensing agreements and through more uses of external manufacturing. So when I went back from the distribution world, I had done about 12 or 14 years as a chief supply officer. I really wanted to go into the chief procurement officer space, right? Because what I recognized and what excited me was the fact that a lot of the execution of supply chain really required third-party relationships and managing those third-party relationships. And because the products have become more sophisticated, the chief procurement officer role gave me an opportunity to have a line of sight across the entire execution of products. So you're there in the early clinical phases, working with the R&D organization. right up through working with the commercial teams in terms of how you're going to manage those relationships and obviously the various ways of executing the product and commercializing the product in different regulatory environments. And then how do we execute and deliver against all of that? So I think, what I've seen over the last 12 or 14 years of my career as a chief procurement officer was that whole end-to-end relationship goes beyond just executing the product. It's right up through, a lot of the business development activities that happen with being able to negotiate some of these pretty significant agreements, right through the ability to get through the clinical aspects of all of that, because the relationships with CROs have become that much more sophisticated and clinical supply has become that much more complex, right through execution.
Yeah. How did you find that move, going from a supply chain role into being a CPO? Was it a broadening of responsibilities, would you say? Because in a procurement role, it's not just the manufacturing side, but you're also bringing in indirects and R&D and everything else. Did it feel like you were given a bigger playground, for want of a better word?
Yeah, I loved it, because I grew up in manufacturing. So I'm a process engineer. And so regardless of what was happening in the world around you, your number one priority was to make sure you could supply the market. That took up 95% of my time. But when I went over to procurement, and again, I went over to procurement, but I had to work for enlightened organizations, right? So I would say about 10 to 20% of the organizations are enlightened. And what I would call an enlightened organization is they recognize that the relationship with your supplier base is critically important to your ability to deliver value to your customer base. Because so much of your innovation and so much of your execution now happens outside your four walls. And I'm not just talking about the execution of your product. I'm talking about the execution of your R&D relative to your ability to execute your clinical trials. I'm talking about the commercial space, because in today's world, you have sophisticated relationships that go beyond just doing direct-to-consumer advertising. You have all of the relationships that happen as it relates to working with various agencies and working with the advent of the internet and social media has been an incredible space. So for me, those organizations that viewed supplier relationships across the entire community are what I would call the enlightened. So I left Johnson & Johnson in the mid-90s because I hate decentralization. I absolutely despise decentralization for procurement and supply chain, because what happens is you can kind of optimize pockets within your organization, but you're missing incredible opportunities to leverage knowledge and learning across the entire organization. Because instead of the organization working to leverage investment and relationships, everybody kind of has their little space and they spend all their time optimizing their space, and there's so much knowledge lost. When J&J asked me to come back after being away 17 or 18 years, the only way I would go back is if they had a different view on the value of the external relationships. And so I went to centralise a procurement organization that was decentralized for 130 years for a company that was close to $100 billion in revenue. And our ability to use technology and cloud-based technology to create, because people and everyone views centralization as bureaucracy and slow, and it's gonna bog us down. But cloud-based technology is an incredible enabler, right? Because instead of adding another step in the process, what you were adding were data insights and knowledge, and using technology to better empower the budget owner.
When you're going through that process of taking a decentralized company, making that sort of big shift to bring everything together into a sort of a center of excellence model, how do you make the best of those global benefits without becoming that roadblock and losing agility?
So first thing, what you need is strong sponsorship from the executive level. So your board and your chief executive officer, and they need to understand the value of this and hold someone like me completely responsible to being able to achieve that, right? That's number one. Number two, but more important than number one, is the budget owner is the customer in the process. So whether you reside in any functional area, whether it's R&D or in the marketing space or in the supply chain space, they ultimately own the budget, and they're the ones that you have to serve and enable to be able to achieve their objectives, right? The key thing is, how do you give them data and insights that allow them to make better decisions? That's number one. Number two, and what I found in my career is business people are given two resources to be able to achieve their objectives. They're given people in terms of teams, whether they're direct reports or project team, but they're also given budgets. And 99% of that budget is spent with suppliers. And I think over the years, we train people to be really good people managers, but we don't train them to be very good supplier relationship managers. So for me, I viewed my role as the CPO comparable to the CHRO role. So as the Chief Human Resources Officer, basically doesn't tell you who to hire, but they give you the tools to be able to allow you to hire the best person that's the best fit. And behind all those tools are all of the risk management aspects to ensure that you're doing it in a way that you can vet the right candidates, you're working with the right partners for source. Same thing with procurement. Our spend budget at Johnson & Johnson in my last year was $40 billion.
Okay.
A lot of money. And in reality, how well not only did we spend that, but the productivity we were able to get from that spend translated into our ability to work in a more efficient way and execute better and deliver the value. So in essence, what we were trying to do was how do we use tools and systems so that when a budget owner has a need, has a problem to be solved, right, they have a quick and easy way to achieve that objective. And you look at simple things like approved supplier bases and having in place approved agreements. So if I have a problem that needs to be solved, do I have enough tools to be able to do that? And what I love about the cloud environment and what our team was able to accomplish there is I didn't have to do what I had to do in the late 90s and early 2000s. I didn't have to put a big, heavy system in place that had to be customized for what we needed. We could use a best-in-class approach with the cloud to be able to do sourcing for consulting, sourcing for R&D, or sourcing. So there's so many tools available to be able to do that. That best-in-class approach allowed our team to be able to customize solutions for the various unique needs. And we didn't go into it with the objective of we're going to add suppliers, we're going to take suppliers out. But the reality is, when we started back in 2016, we had over 90,000 suppliers. And when I finished up my tenure, we were at 44,000 suppliers.
Oh, wow. That's a big drop.
It's a big drop. That's, for us, we were saying we took out over 50,000 points of risk, right? And now the issue becomes, so we took them out, but did we allow or did we empower those budget owners to better understand where the risks were, what the relationship should be, and did we give them time to be able to better understand what problem they were trying to solve in the first place, right? Because our team went from, hey, we'll go out and find somebody for you, to more about way up in the stream. What problem are you trying to solve? Example. One of the things, and we're still trying to manage our way through this globally, but I view the pandemic as a significant part of our life experiences, just like a world war. When you think about it, we in the world had a war against a virus, and that was a significant impact. It was terrible, a lot of lives lost, and we're going to live with it for a long, long time, right? And one of our responsibilities that we took on through all of this was to come up with a vaccine. Okay. Now, I would say our vaccine was there in case the mRNA vaccines didn't deliver. And thank goodness, right, that they were there and they delivered and they did an incredible thing with all that. And we had a place in the world for all of that. But you also have to understand that Johnson & Johnson, unlike Pfizer, we never had a vaccine on the market. So we were starting from zero to be able to do that. And we were able to mobilize over 200 suppliers of, raw materials and consumables to be able to do that, to have to be able to execute over 600 million doses in the first year and obviously a billion plus from that point on.
And all in a very short period of time.
12 months.
Yeah.
12 months. So, something that would take me 10 years in the past, took 12 months. So that's how innovation, when people come back and work together.
What was that like, moving at that speed? I mean, were you told we're going to have to do this and then form a group or brief out to all the suppliers? Could you just give an overview of what that process was like, please?
Yeah, so it was an incredible mobilization of everyone within our organization. And I think it was an incredible mobilization of the entire industry to be able to do that. And so from our perspective, we absolutely had to put teams on this that were dedicated. We had to engage with existing suppliers and onboard new suppliers to be able to do that. We had to go upstream where we never had to go before to be able to invest in capacity, right? You talk about things like refrigeration. The whole industry had to work with suppliers that could provide the refrigeration to be able to store and transport all of those vaccines. So there was a lot of collaboration within the industry. We were tapping into capacity that also was that we needed for life-saving drugs that we were putting. So there was an incredible amount of collaboration that was happening within the industry about being able to better understand where we should put that capacity and shared information that we never shared before. It was fantastic to be able to do that. We also had to make significant financial commitments to business partners to be able to do that. And bring together quality organizations, regulatory organizations, bring together that whole cycle of what it takes to be able to put something like that in the marketplace, as well as with government and regulatory bodies to be able to. So, I would say just like, that's why I feel like I just came through a war to be able to do that. Me personally, 40 years of experience. I don't know if you're a golfer, but I had to pull every club out of the bag to be able to do that, right? Because, to get anything done in any environment, business or personal environment, it takes three things. It takes data. So you need information, right? It takes knowledge and insight from that information. But, I think one of the aspects of anything in life that's sometimes undervalued is wisdom. It takes wisdom too, right? It takes some experience of knowing, hey, I've done that before. Let's try this. Or, hey, I've done that before. That might not work. So so there was a lot of wisdom that we had to tap into across the entire organization in every phase of being able to do that. Right? So going back to this, we can sit here and talk about the supply chain aspects of it, but let's talk about a different piece of that. We had to go to clinical trials on that particular vaccine. And what we were learning through the early phases with some of the other vaccines were that, the biggest impact on the virus, especially in different parts of the world, like the United States and Europe, were in communities like the Black and brown communities, right? They were really big. And those were communities that weren't necessarily engaged as it relates to clinical trials. There's a lot of trust issues associated with that, and we had to bridge all of that. And one of the things we wanted to do as well was we wanted to do a late phase clinical trial with over 35,000 patients, which is the largest clinical trial that we've ever done. I don't know if anyone's ever done one at that level. So our organization, working with our commercial and our research team, worked with a couple of incredible third parties that were able to do the type of AI modeling that we're talking about today to be able to execute a clinical trial that's that scale and scope, right, at an accelerated rate. So those are the types of things as a CPO you get exposed to from an end-to-end standpoint that, in my previous life as a CSO, rightly so, I was head down, get product out the door. So those organizations that say, okay, if I'm going to spend X billions of dollars across my entire network, and if I can partner my chief procurement officer and my chief financial officer together to look at two things. My chief financial officer is going to make sure that we understand what we need for a budget and we can achieve those budget objectives. My chief procurement officer should be working with the business and my chief financial officer to make sure I'm getting the most value from that investment.
How would you measure that investment? Because it's not just on the traditional cost savings. How should a modern CPO prove their value?
Yeah, so I think what you want to do is you really want to be able, if you can be there early in understanding what you're trying to solve, if you can be very knowledgeable of the market where you're going to get those competencies, right? So every organization has to make two big decisions. What competencies am I going to invest in internally, right, to achieve? And then what competencies do I need to invest in externally to be able to achieve those objectives? So you need to be there early when you're doing that business planning process around those competencies. And you need to be 6 to 12 to 18 months out in front of the business around those external competencies to really know what's happening in the market in terms of who are the innovators, who are the high level performers, who are strategically aligned with your organization and where they want to go, who really can bring you maybe a unique form of innovation that allows you to differentiate what you're trying to accomplish out there. So understanding the external markets for what your business budgets are trying to invest in, and then helping to create that partnering with the business partner who has the budget, who's trying to solve that problem. And, we started to measure our success around cycle times. How quickly could we go from identification of a problem and the ability to get a supplier started and on it? And probably the most time I spent in that space was with our legal team, right? Because, when you start to talk about a complex world where you're trying to manage intellectual property, when you're dealing with a heavily regulated environment, when you're operating in 70 countries around the world, the number one issue sometimes around speed is, how do I put an agreement in place that allows us to feel comfortable we're working with the right partner, and we get that partner started on the work that needs to be done, right? So we measured things like cycle time. Working with legal, we cut cycle times in half. We looked at things like, why are we contracting, where we could use plain purchase order boilerplate. We looked at things like, hey, what's the nature of that contract, and what should we put into that contract that really is relative to these relationships, and what can we take out that's not relative to these relationships.
Why do you think that so many in procurement roles struggle with that credibility piece and being there for those early conversations and not after decisions made and then just get it for the cheapest price? How can more people get more into that strategic space?
Yeah, I get asked that question a lot. I think first you have to be comfortable being able to be an influencer and a business partner. So you have to understand the business. You have to understand and empathize with the pain points. You have to be good at selling, right? So what you're trying to do is you're going to move away from, hey, I'm really comfortable chasing savings, so I'm just going to chase savings, make my numbers, get my bonus, and move on, right? As opposed to, hey, I guarantee you we're going to have more savings than you ever thought we could have. But I really want to talk to you more about innovation. I really want to be able to talk to you more about, but the only way I can do that is I need to understand your world. I need to understand the problems you're trying to solve. I need to understand the markets that and I need to bring you knowledge and insights. I just can't show up and say, I had so many procurement people show up to senior executives and say, how can I help? That's the wrong question to ask, right? You need to go in there and say, hey, here's what's happening in the world outside of what we're investing in our own internal capabilities and our external capabilities. And here are some opportunities or some stories around where we can help you in being able to do that. So, what I told my senior procurement people is become a better storyteller. And you've got to be able to tell your story in 30 seconds, right? Because if you're not going to catch somebody's attention in 30 seconds, you're not going to be there. You're talking to busy people who have a lot on their plate. Be really good and really smart in understanding what the business strategy is and what our investments are as it relates to those business strategies. Third, once you understand that, you better go out there and find out what's happening in a competitor space, in the new innovation space, and in the partner space to be able to close those gaps or to bring that value. So you get into conversations with senior executives where you bring some insights. I'll give you an example. One of the areas that was pretty exciting when we started this journey for our executive team was how much money we were spending with consultants, which is kind of a taboo area in many organizations. So we brought some of that data to some of the highest levels in the organization. And then we started to look at the nature of those projects, the outcomes of those projects, and we started to better understand, were we working with the right people, with the right knowledge in the right space? Needless to say, working with our executive team and putting together a collaborative panel of representatives across the entire area. So we had representatives from the major functional areas and from the various regions of the world. We were able to take a significant chunk of that spend out, right? And see more productivity as it relates to that. So what happens is when you start to get into areas like consulting, not only are you seeing what's being spent there, but a lot of your consultants do strategy work for your teams. So they became a great source of knowledge for us, right? Because they were like, all of a sudden procurement is sitting at the table and they're really interested for some reason in what we're working on and how we're delivering against all of that. So for me, I was not only interested in what we were spending, I wasn't interested in saving, right? Luke, I was really interested in understanding the various strategic areas we were using the consultants to be able to achieve our business objectives. I think for procurement teams, can you build the internal relationships that are the bridge to what they're spending and how they're spending externally? And that's a hard journey. And that's a leadership issue. And that's CPOs and CPO leadership teams having the credibility, the trust, and the ability to deliver on promises. And you have to make big promises in this space sometimes, right? But once you are able to cross that bridge, it opens up an incredible world. And you say to me, Len, you put that together, and there's an intellectual argument for that, but you also have to find what the emotional argument is for all of that, right? Because for any of us as human beings, we do our best work when we can connect our heart to our mind, without a doubt, right? Because if we feel passion for what we're doing and we're working in a purposeful way and making a difference, that allows us to get dimensions of value out of those relationships. So when we were putting together some of the promises of all of this, yes, we talked about managing risk, building resilience, getting greater transparency in our supplier base, using technology in a positive way that would give us better data and better insights to make quicker, smarter decisions. But we also talked about how we were going to use this as an opportunity to accelerate innovation, leverage innovation across the organization. Here's another example. One of the areas that we worked on early in my tenure in this was just a greater use of contract field force, right? And it was an easy conversation in the pharma space, right? Because they have peaks and valleys with launches and everything was great. But we also have, or they, I should say, even though I have a multi-year, but Johnson & Johnson was a very strong organization in the medical device space where they didn't use any contract folks, right? Okay. But what was happening was we went over and had conversation at the highest levels and said, boy, some of your field people who are critically important and knowledgeable to surgeons, all right, around the use of the new technology, our new innovations, and our various tools are not spending all of their time in the area where they can bring the most value to the company. Well, what do you mean? Well, they're spending a lot of time doing inventory management and some fundamental work. So we said, what if we could free up your incredible field people who have the relationships, the knowledge, the expertise in working with the surgeons and the surgical teams, and use third parties to help do some of the fundamental work? And obviously, there's a different value to all of that. And it was, and we had the experience and the credibility of what we were able to do on the pharmaceutical side to be able to do that, right? So that's where having that kind of centralized knowledge was transferable across the organization to bring incredible value. So those are the types of things that procurement can do and should be doing. And in reality, if I'm a CEO or I'm a board of directors in a world where, when I started in supply chain and in my career between, 1982 and 2000, the world was experiencing about 200 disruptive events a year, right? Climate issues, hurricanes, earthquakes, geopolitical issues. Between 2000 and 2020, it doubled. We were experiencing 400, events a year. They're predicting, and we're experiencing now, 500 to 600 disruptive events a year, right? And so boards and CEOs, and listen, they're probably the most challenging jobs that exist in the world today. Being a CEO or on a board of a public company today is not what it was 10, 20, 30 years ago. The responsibilities, the unpredictabilities, the uncertainties are exponentially greater, right? But, a lot of investment has been made over the past 10 or 20 years on understanding what's happening with your customers. Maybe at the expense of recognizing you need to understand what's happening with your suppliers. Yeah. And maybe even with your employees. When we were going through the pandemic and we had to keep, life-saving drugs up and running, never in my career I had to work with our government affairs organization in country after country, because we had to keep our plants open in countries that had all different policies on how they were managing the pandemic. So not only did we have to worry about, can those suppliers continue to run, but we had to worry about their employees, their employee health, and the health of the environment that they were operating in, right? And so if you add all of these dimensions of what we experienced in the pandemic, and now you're seeing things like, we were just talking about some of the challenges this summer around the heat, right? And is there power to keep some of these facilities operating in places like the American Southwest or in the Mediterranean countries of Europe? Or we talk about the geopolitical issues that we're dealing with, right? So now I have to be able to understand what's happening with my suppliers and my suppliers' employees in order to fulfill the promises of my customers. And I think that's adding a lot more complexity. And so now, if I'm a CEO or I'm a board, I need to understand not only are my employees safe, CHRO, right, so that they can come into work and get their jobs done, but are my suppliers able to keep a safe environment for their employees and, throw ESG on top of that? What parts of the world are they at? And is it safe for them to even go to work or be at work, right? And so now we're starting to hear things about we need to diversify our supply chain.
So what do you make of the legislation coming out of Capitol Hill at the moment and the pressure around reshoring supply chains from China, happening in Europe too, of course, with President Macron doing something very similar for France? What kind of a challenge do you think that's going to present the industry?
I think it's a big challenge, right? Because, I was old enough to be there when the wall went down, right? And all of a sudden, right now, the world was more open to globalization and collaboration and trade. And it was wonderful. And innovation thrived through all of that. So now you have what we were talking about, the unpredictability and the uncertainty. You have companies that are global. And when you're global, everyone in the world is important to you. Your customers, every human being in the world is important to you. Your employees, every human being in the world. So you have blinders on to any of those issues. Your number one issue is, especially in our industry, is the health and well-being of your customer base, right? Of every human being. Mm-hmm. So you have that complexity. And now you're talking about a supply chain that is becoming even more complex and even more sophisticated and customized around things like cell therapies, right? And gene therapies. So a supply chain that went from a push supply chain to an end-to-end supply chain is now becoming a closed supply chain, where your raw material now is starting out with your patient's blood, and you're now the steward of that raw material through every cycle. And the stakeholder community is incredibly expanded now, right, as it relates to the patient, the team that's working with the patient to drive a positive outcome, the payer who's hoping that you're going to drive a positive outcome. And that now becomes an era of risk sharing, right? Because now you're part of that team and the outcome is critically important to your ability to be compensated for something that's very sophisticated and very expensive. And so I think you've got this three-dimensional issue of innovation moving at an incredibly accelerated pace, the world going through an incredible transformation, just like it did after other significant events, like World War II. This pandemic is a significant event, and you've got an incredible amount of impact as it relates to a whole new set of stakeholders that are going to be involved in all of that. So I think the ability to collaborate with not only that community that you're associated with the patient, but collaborate within the industry and still compete is going to become something that we're going to need to do more of. And obviously, better collaboration with some of the key government figures that are associated with the regulatory environment, right? Because if you get to different levels of over customization, then you're going to have a diversified supply chain that can accommodate that.
You've spoken in the past, Len, about the age of scarcity. And I'm just wondering if you've got any advice for people in procurement who are living through this and want to be enlightened and they want to make an impact in their careers. What advice would you have for people?
I'm a firm believer that organizations need to elevate supplier relationship management to the same place they've elevated customer relationship management. Mm-hmm. And I think procurement teams that can use technology to do and continue to do a lot of the tactical work that they're comfortable with, they've got to step outside of their comfort zone and really start to recognize that if they can bring to their organization those incredible competencies associated with supplier relationship management. So it's really understanding your entire supplier base. It's understanding how you want to set up that foundation and where you want to set up relationships at a strategic level, at a collaboration level, and more of an arm's length level, constantly managing that dynamic. Before you kind of did it once and then you walked away from it. Now you've got to do it on a real-time basis. And so you're really going to have to expand your capabilities, your skills, and the tools that you need to be able to do that. And you really need to make sure that you're able to communicate with the highest levels of the organization on what that means from a change management standpoint. Budget owners sometimes want to make the decision around, I want to work with that supplier because I have a great relationship with them and they've worked in the past. Well, how do you find the bridge between that? And guess what? When you look at it on a more strategic level, when you're looking forward as opposed to back, right, around the issues we just talked about, diversifying the supply chain, the complexity of the world that we're dealing with, right? The ability to manage that complexity and build resilience, it might not be the optimal relationship for the broader organization. So how do you allow that decision maker to have the knowledge and the comfort and the trust to be able to make that decision in a more balanced way? So it's really, I see it as a window. Do procurement leaders and procurement organizations have the ability to step through that window in this time of scarcity to really deliver that value and that comfort to the CEOs and the boards who are scared to death of the responsibilities they have in today's more complex world? That's the question. Look at what's happening with employees. Look at, here in the States, the actors all went on strike today.
Yep.
So the actors are basically saying, okay, CEOs, you're making a lot of money. You're streaming all the content that I'm putting out there. You're using AI to replace all of the background actors that kind of relied on you. You're replacing all the screenwriters through AI. You're using all this technology. And guess what? There's a point where employees really need to be an important part of all of this. And how are you going to be able to do that, right? And so now I'm Bob Iger, right? I just got my contract extended. I'm 70-something years old and I'm running Disney Plus. and my employees and the key people and all my stars are going to be part of this union and whatever. So how do I find that balance and all that? And it goes back to what we were saying before. Does he have the relationship and the insights around where I can use technology? How can I use technology to deliver my value? But then how do I balance that with how I better use my people, my employees within the organization to be able to do that? And I think that's a great opportunity for CFOs to really partner with their CPOs, right, around, and the CHROs around these three critical assets: funds, third-party capabilities, internal capabilities. Can CPOs sell that story, and can they sell that story around innovation, around value, and around purpose? Stay with Disney, right? Purpose and all the issues that they're dealing with in the States around some of those purpose issues. I talk about the journey that we went on in my most recent assignment with Johnson & Johnson. So when we stood up and told the organization, that we're going to bring value, and when you look at kind of what we left behind after that wonderful 7 or 8 year journey that I was part of, we saw value increase by 50%. We saw innovation get expedited by 2- and 3-fold relative to the ability to get things done. But one of the important aspects of a company like that was its commitment to purposeful spending. And so one of the commitments that we made as a team to the business was we were going to double our spend with women-owned and minority-owned suppliers. We were already part of the billion-dollar roundtable. We kind of flatlined over the first few years. We were part of the billion-dollar roundtable. So the business said, well, wait a second, how can you do that? How can you improve value? How can you accelerate innovation? And how can you double purposeful spend? And the number one, there was 2 issues, Luke, that we had to overcome with that. One was, how do we better engage the budget owner in that journey? Because the mindset and the perception of the budget owner was, well, if I got to use a minority supplier, I'm gonna have to make a sacrifice. I'm going to sacrifice innovation, or I'm going to sacrifice value. So we had to cross that bridge. And the second one was we had to educate them on the community impact of using those diverse suppliers. Yeah. And we had to go global, right? And so what we did was a couple of things. We expanded global. When I left, we went from 1 country to 18 countries to be able to do that. And 2, we used technology to enlighten the budget owner, right? So we brought that story to the budget owner and fundamentally said, here is a diverse supplier that's approved that you could use for your particular application, and they're in your community. And here's what they're doing in your community. And the budget owners loved it. And guess what? We more than doubled it, right?
That's great.
And I think Johnson & Johnson publishes what they call a healthy humanity report. And I think the most recent number in my last year was over $5 billion, right? Globally, and being able to do that. And here's the thing. It's part of diversifying your supplier base, because many of these suppliers are local. And so guess what? Those same diverse suppliers are the same suppliers that you're going to church with on Sunday, or you're seeing in the grocery store, or whose children go to school with your children, right? Because we made it part of their community. And you know what? They also represent your customers. So they brought you insights and innovations that you never thought of before. We talked about earlier in our conversation, we talked about the vaccine. And 2 of our critical suppliers on the vaccine, one in India and one in South Africa, were women-owned diverse businesses.
Great.
Right? They brought innovation, they brought community, and they brought an incredible value during a dangerous time to those parts of the world, right? So, procurement has to be able to understand the business strategy, has to be able to understand the pain and the pressure points of the business, has to be able to understand where internal investment needs to be complemented with external investment. And it has to be able to tell the story of how being more strategic and more sophisticated and more technology driven in a world where scarcity, because of all of these unforeseen events, is going to become more the norm, and your ability to get your product to a patient is going to be that much more difficult. But your ability to do that is going to be critically important to the reputation of your organization and the value to your customers, your employees, and your shareholders.
Len, it's been wonderful speaking to you today. Thank you so much for your time.
My pleasure, Luke. And I hope that in these uncertain times, that the opportunity for many of my colleagues in the function are there. They continue to grow, and obviously for me, in an industry like ours, which is so purposeful, which is so meaningful, it touches people every day, our own families and ourselves. I just feel for many of these wonderful people, these wonderful leaders that are working in this complex world. We've got some really talented people out there that are really going to continue to make a difference. And what our industry was able to do through this pandemic is just an example of how important the work that they do is to the world. And your team and your organization is really doing a great job of spreading the word of the value of what we all do.
Thank you, Len.
Take care, Len.
If you work in procurement in the pharma or biotech industry, then why not register to PharmaSource, a private members community designed to connect you with peers, share best practices, and discover new suppliers. Head over to pharmasource.global for your free membership.